My name is Nadine Poppinga, and my family and I live in Brookings, and I am a farm marketing manager with Hurley & Associates. I had been experiencing some abdominal pain for a week or two, and I thought we were going out of town for the weekend, and I thought I should get that addressed before we leave for the weekend. And I actually called that morning, and Julie Cameron was available, and I was able to get right in and see her. She referred me over for an x-ray that same day, and upon that visit and review of the x-ray, she then referred me over to Brookings Health System for a CT scan that same day. And I was maybe somewhat surprised that they just immediately got me into those next appointments the same visit, essentially. So I was impressed by that. The CT scan revealed that I had some diverticula that were inflamed, and it's a digestive issue, and certain foods can bother you at different times. They easily were able to treat that immediately with antibiotics, and I could just go on about my weekend and my regular schedule. You know, the first thing that pops into my mind is, do I need to go to Sioux Falls? Is it going to be another day, another couple of hours off of work, away from my family? You know, I just wasn't sure how that was going to be. So it was a real benefit, and just so seamless just to come here to the hospital immediately and get that taken care of. When the CT scan was being read, they also noticed that I had some lesions on my pancreas at the same time. They were small, as it seemed in the CT read, and they then referred me for an MRI about a month later. That service also was able to be done here at the hospital. Again, it was very convenient. I did that over a lunch hour, and it just was, again, a seamless process, and I felt like it was a privilege to have that level of care right in our community. And they will now just be monitored annually, and they're part of my preventative care every year. It was nice to get that reassurance so quickly. Within really a month's time, we found out what they were and were able to address them as much as possible now. It was just shocking to me how quick everything was. When the services were done, I think within the business day, I had the results of the CT scan, and the MRI was also very quick. And when my regular doctor got back, she was able to review them right away, and it was just so seamless and efficient. I felt like the scans were done here at the hospital, but they were very quickly sent over to Sanford, and there really wasn't any difference to me had I gone down the hall at the same facility and had that done versus going across town. And electronically, they could connect all the information that they needed to very easily. I've never had an MRI, I've never had a CT scan, and the staff here was very professional. I knew exactly what to expect with those services here. I was fully aware of how long they would take and when the results would be read. There was never a crowded waiting room. It was just really easy. And then just the ease and the reporting back to me and my doctor, so that we knew what the next steps were. So I can't imagine getting these types of services any better or any faster anywhere else.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.